Good morning, Dr. Hamilton. How are you?
I'm good. How are you?
I'm doing well, thank you. Thank you
Good.
so much for being here today. We're excited to
No,
have
thank
you
you for
on.
having me. Thank you for having me.
Absolutely. So let's get started. How did you get into the wellness industry?
Well, I got into the wellness industry essentially through my bariatric practice. So I went to med school, wanted to focus mostly on weight loss. And then during my weight loss surgical practice, it expanded into so many different things. And I quickly realized that wellness and weight loss kind of go hand in hand. I can't just treat the weight loss without treating a lot of the other issues that in wellness, it kind of all works together. And so a lot of it kind of went into that, and it's constantly changing. And I think wellness is the way to go in the future. I think that will help prevent a lot of future problems if people kind of focus on wellness first, so to speak. So then that kind of became my goal. But that was after I was already practicing and seeing that wellness actually should be the first step and not kind of the afterthought, so to speak.
Right. So wellness over physical goals for sure.
Yeah.
Yeah, absolutely. I love that. So what drew you to becoming a bariatric surgeon and pursuing the study of weight loss and habits rather than just sticking to bariatric surgery?
Well, I went into bariatric surgery. I initially wanted to treat the kind of the severe obese and the super obese. And then it kind of started with everything because that group often would happen to me when I was younger, always had these labels attached to them. Like labels like they're lazy, they're this, they're that, they can't do anything. And I knew that wasn't true. And so I was always attracted to helping people in that field because I often had some of the same labels just because I was the one that kind of in class didn't pay much attention. But that didn't mean I wasn't making straight A's. It just meant that that was not the way that I like to learn. I was better off doing stuff on my own at home. And so I almost felt like I needed to help those people because having been in the same boat where I was labeled one complete incorrectly, completely, I wanted to kind of help them show their true self, so to speak, and help them realize that the labels that was external was not who they were. And so I started that with, that's what got me into bariatric surgery. And then once I got into bariatric surgery, it just became so much more. Like I really got to know my patients. I really got to know who they were and what their needs were. And then it just kind of started transforming into wellness, into helping treat anxiety and depression, into like all these different things. I mean, it was great. It was a real eye opener because we didn't learn that in med school.
Absolutely. Yeah, they typically don't teach you how to be well and how to take care of your mental health and mindset in medical school. So I love that you're teaching this because not enough people do.
Yeah.
It's amazing.
Yeah.
So as a bariatric surgeon, you've had a number of patients over the years and they come to you about weight loss and how they struggle to keep it off. What's the most consistent thing that you've noticed that's hindering their success?
One of the things I noticed is going to be their own motivation, believe it or not. Their own motivation and then the narrative that they're telling themselves. This is, and it's negative. It's not like positive. Believe it or not, a lot of people want to lose weight, right? But they don't feel like they can for multiple reasons. And that's become one of the strongest things that's holding them back. And that's kind of why I wrote the book, Transformation as a Mindset, because I'm like, stop telling yourself that you can't. I mean, they would come to me and they want to do it, but then they go for a week or two and not have the success they want. And then whatever voice in their head goes back to telling them, you can't do this. You should just give up and stop trying right now. And they lose the motivation. And then I may not see them for a few weeks and then they'll come back. So I think the biggest thing that's holding people back from losing or getting down to what they want, or when they regain, it's truly the narrative that they're telling themselves. And I don't know if they've got that from the world, from their environment, from who knows, just telling them that they can't do it, they're not going to be good enough, et cetera, et cetera. And that just really defeats them. So
Absolutely. And you've created a program that actually focuses on what that main issue is. Can you tell me a little bit about the Four Pillars program and what inspired you to create it?
yeah, so four pillars of transformation. My patients actually inspired me to create that program. And so initially, my bariatric surgical practice was just you come in for weight loss. So we either do medical with pills or we do surgical. And then that was it. And a lot of them were regaining. And that's when I noticed that the narrative they're telling themselves is not the best narrative. And so I felt like I had to dig deeper. So when they used to come in the office and was like, I want to lose weight, I'd almost like, okay, back up. What is your motivation? What is your why? Almost like having to find that why. And then once you find it, it's usually rooted in one of the four pillars. So that's why I created four pillars of transformation, which is medical, behavioral, mental, and environment. Believe it or not, there are some things that are rooted in the environment, the company you keep, the people that are not supporting you, people that are talking down to you or being negative towards you. And that kind of plays a role on your mental psyche. And that's the reason that you may not have the motivation or feel like you can't do it. And so it takes a lot of trust and it takes a lot of getting to know the patient, because most of them don't come in and tell you the reason I'm struggling with my weight is because I feel depressed and I have self-hate, right? For example, that would be in like the mental pillar. They don't tell you that. But once you ask more why questions and kind of what's going on, you can usually find the root of their weight loss issues, whether it's regain, can't lose, whatever the case may be, rooted in one of those four pillars. Diet and exercise obviously plays a role, but you have to find where the root is, because if they're depressed or anxious or whatever it is, the root is, they're not going to want to do diet and exercise anyway, or they'll do it for a short amount of time and then just divert back if one of the four pillars, the roots in the four pillars, is not addressed. So I noticed once I implemented that program in my bariatric surgery, I started with that first. Then they got the surgery or the medical weight loss, and patients were doing significantly better, and they kept it off. They maintained it because we treated the root first.
Wow,
Yeah.
that's amazing.
Yeah.
That's
Thank you.
incredible. Yes. So when you're talking about your root, how do you know when you found it? So what's the secret to discovering that true root? And is it true that you can have a root in all four pillars
Yeah.
and not know
Yeah.
it?
Yeah, so I'll give you an example because I think this is the best kind of way to explain it. So, one of the ways you have to do it as a provider, believe it or not, sometimes the patient can't get there by themselves. They need someone to bring it out of them, and the patient can't do it by themselves. So, you need someone to kind of help you through that. That's why Four Pillars is not just for patients, but it also is for providers to help get patients, and everybody's a patient, I'm a patient, you know what I'm saying, get to where they need to be. So I have this patient that I've been seeing for weight loss, male. He came in for a follow-up visit. He gained 20 pounds and he also had elevated blood pressure. So when I saw him, I'm like, what's going on? Like, why did you gain in a month? Why did you gain 20 pounds since last month? And now your blood pressure is high. And so he was like, well, I started eating more. First he said he was deaf and he had cochlear ear surgery. So he says, well, I got my surgery done. And so first I was like, well, was it the surgery? Like, is there something going on? And I was like, oh, well, did the surgery go okay? And he was like, yeah, the surgery went okay. And I was like, well, are you excited? He was like, I was excited because he was so excited he was getting that surgery. I knew he was going to get the surgery. And so I was like, well, what's going on? He's like, well, I started eating more. And I was like, well, why did you start eating more? Did you start eating more because of the surgery? He was like, no, it wasn't the surgery. And I was like, okay, why did you start eating more? And he started eating bad, like junk food. And he was like, well, I guess because I was feeling down. And I was like, well, why were you feeling down? I'm on my third why at this point, right? And he was like, well, I got the cochlear ear surgery so I could hear the music better. He was a ballroom dancer. But my family thought I got the cochlear ear surgery so I could talk better because he's deaf. He was like, I've been deaf for 40 years. I didn't want to talk better. Like, this is who I am. I wanted to hear the music better. Bam, that's the why. His why was a mismatch in expectations. His expectations, his family expectations. So his family is just like, well, why can't you talk better? Why this? Why that? And he's getting all depressed, which is in the mental. Then he eats more. That's in the behavioral. And now he's gained 20 pounds and has high blood pressure, which is in the medical, right? But his main root is in the environment. It's the company he kept. Self-talk, negative self-talk to him, and that triggered this chain of events. And so for me, I had to ask the why. I knew him well enough that I'm like, what's going on? So essentially, my treatment as the provider, and that's what I'm saying in 4 pillars, find the why, because that's going to trigger all these chains of events. He had a root in all the different 4 pillars, right? But if he would have just changed his environment, I'm like, then you need to change your environment and go listen to your music at the ballroom dancing, right? That's what he needed to change. Like, right now, you don't need to hang around people that are going to not be supportive of what you decided to do. You need to change your environment. And then, so I didn't treat him. I didn't treat him for his weight gain, and I didn't treat him for his blood pressure. The next month, he went back to ballroom dancing, 10 pounds. He lost 10 of those 20 pounds, and his blood pressure was back to normal. So all of that came from the root pillar of environment. And so that's kind of the difference. So,
Um,
yeah.
that is truly amazing. What an amazing
Yeah.
transformation for him.
Yeah.
And
Thank
that
you.
realization, and I'm sure he went through a lot of mental like gateways to get there, and
Correct.
that's amazing. I do have a follow-up to that story, or a follow-up question. So a lot of my clients as well, they do have an environmental issue, especially within their family not being supportive. How do you overcome that? Because you can't just, pack up your stuff and move somewhere else. How do you how do you go through that with your patients and set
Yeah.
realistic goals for themselves?
Yeah. And so, first of all, just figuring out what it is the first step, right? Self awareness of what it is. Some people don't even realize it's their environment that's holding them back. Like, he didn't even know. He was like, well, I guess I was depressed, and I was like, why? And so, what I always tell my patients, I was like, we can't change our spouses, our kids, you know what I'm saying? Like, our jobs to some extent. There's some environments that cause all type of stress that you can't physically change, right? You can't quit your job. There are some people that I'm like, they didn't like traveling to work and they started picking up bad habits like smoking. And I'm like, well, can you work from home? Can you go to work 3 days a week instead of 5 days a week? You know what I'm saying? Different things like that. And if they absolutely can't change their environment, I'm always like, then be aware that this exists and you can't change the environment. So you need to change the way you react to the environment. You know what I'm saying? Like, don't let certain stuff bother you. Don't let, and even him, I'm like, so if they come to you and they kind of are talking to you about why can't you talk better or why can't you, just be like, well, that wasn't my plan. My plan was so I can hear the music better. And it's almost like putting your feet down on, this is what I want. And if you're not going to be supportive, I'm here in this environment, but I'm almost not going to let you take that away from me. I was like, why are you letting them take away your joy? That's yours. Don't let someone else take away from it. If you are in a work environment that's stressful, and I've been in situations as a female where I feel like I'm hitting a glass wall or I'm not going to let someone else take away my joy. It's like taking that back. I'm going to be in control of that. So if they're in a certain situation or environment, don't give that their control of that. They need to take back that control. So that's what I usually tell them. Yeah.
No, that's perfect. And
Yeah.
would you agree that that's the first step in setting realistic goals, is self-awareness and
Yes.
what you want? Mhm.
Yes, 100%. And that's kind of where four pillars also stem from. Like I feel like certain things are more important in wellness than what people advertise, right? Self-awareness, like what do you want? What is your why? And then keep that as your carrot. Don't who cares whatever anybody else thinks or what other people think. You need to know what you want. And then you need to be in control. That's kind of like my second step. You need to once you find out what it is, but you'd be surprised how many people don't know. They just don't know, or they don't know their why. Like, why do you want to lose weight? Like, once their why becomes strong enough, it'll kind of overtake a lot of things. So you almost have to like coach people to kind of get there, like answer that question. And it may take them thinking, like, why am I doing this? But once they get there, that's all she wrote, so to speak.
Yeah, absolutely. So in a sense, you're almost like their therapist and
Yeah.
their surgeon as well. That is awesome. That's awesome. So perfect. So I do have another question about the four pillars transformation program. And so when someone comes to you for weight loss in the program and they they find out their roots and they find that ultimately they have more roots than the actual weight loss problem. So how do you work on these how do you work on these simultaneously, and how do you find a way to address the roots first?
Yeah, so an example would be you're right, someone comes in for weight loss and their main problem is I get a big is carbs and sugar cravings. And that's the reason probably for some of their weight gain. And then that usually stems from something. So I have to figure out where that stems from. So that may stem from a stressful environment, for example, or they may actually have like a medical, thing that's triggering kind of some sugar cravings. They may be pre-diabetic, they may be. And so I have people that have both. So essentially we have a patient who comes in for weight loss. They also have sugar cravings. So they eat a lot of sugar. So that's the behavioral, right? One of the things that's triggering that is stress, a stressful, say, work environment. So that's in their environment pillar. And then because of that, they're also pre diabetic. So then that's in the medical pillar, let's say. And so they have weight loss problem, but then they have all these different things kind of that needs to be addressed. And so usually most people don't even know that their sugar cravings can be stemmed from something. First of all, they're just like, oh, I just like this and like that. And some people don't, their habits, right? I have some people who are at a desk and they just have their bowl of candy and they're just eating throughout the day. And they don't even know that their bowl, that they're doing that. You'd be surprised. Like, I'm like, you need to become aware of what you're doing. And so I usually treat all of them. I explain to them what I think is the problem. And then we usually start with one or two things because trying to do too much at once is usually overwhelming and most people can't do all of it at the same time. So I'm like, okay, if your environment is stressful, I figure out ways to kind of fix that. Like, don't put themselves in certain situations that's going to trigger them to do bad habits, right? Like if somebody get the ice cream out of the house, right? That's an environment. Don't leave things that's like obviously there. Don't go out with girlfriends when you or friends that is going to make you eat bad. So those are like habits, behavioral things that you can kind of try to cut off immediately. And then usually if there's a medical problem associated, I start treating that medical problem. And then for their sugar craving, I usually just want them to become more aware of when you're eating it, what's triggering you to eat it. And then we kind of go from there. So that's how I would start, right? I usually don't say, okay, then go do 4 days of exercise and then go do a keto diet. That it's like too much on a first time visit. The first thing they need to do is just to kind of become awareness and then where these roots are. And then we pick two of them, maybe three, and we start treating it. Usually one requires medication, and then the other one is the patient. Like, I want you to just focus on this. And that's usually how we do that. So even if they want surgery, if they want medical, we do that first. They don't get any weight loss stuff, really. But treating those things is actually treating the weight loss long term. If they were just to come in and I would give them something to help their sugar cravings, I don't feel like I'm helping them. Because once they're off of that, it's just going to come right back. We need to find where these are stemming from, and they need to be aware of where it's stemming from. So when they see it, they can take control of it.
Absolutely.
Yeah.
Absolutely.
Yeah.
And in a way too, when you have these conversations with your patients, let's say you give them an assignment and it's to become self-aware, that will show their commitment.
Yeah.
And when someone is undergoing this change, they have to show some form of commitment before they actually, get the surgery, correct?
Mhm. True. Yes. Yes.
Because
Typical bariatric surgery practice. Before I did 4 pillars, it was just an insurance requirement. You need to go see the nutritionist once a month for 3 months. You need to get a psychology assessment, and then after the 3-month nutrition visits, you get your surgery. That is typical. Yes, that's typical. That's really all that's required, like on paper from an insurance. But that's when they come to my office. I'm like, no, we're not doing it that way. This is what we're going to do first. We need to figure out why this is going on. Start with that before we even get into the pathway. So,
do you
yeah.
still have those requirements, or is there completely different requirements in your program?
My programmer is those requirements. They have to do almost like mindful things before I will even put them on the track for surgery, or even medications. And medications for us is easy, right? But I feel like if I just give you a medication, I'm not helping you. If I just give you a surgery, I'm not helping you, because once you're off the medication or once the surgery, you just regain. And the 4 pillars, I feel like you have to do those mindful steps first. You have to figure out where the roots are if you're going to have sustainable health and wellness, honestly. So, and you believe it or not, I have some patients who are like, we just want the surgery. So I'm like, okay.
You don't want to do the work. Well, that says a lot. I mean, so that's actually another question that I had for you is, when you get patients like that just want the surgery and don't actually want to do the work, do you kind of see that as a cop out? Because you do have the surgery option, and you can, they can just come back and get surgery and surgery. Like, how do you feel about that?
Well, and that's 4 pillars started because I was doing more revision surgeries than primary surgeries, meaning they had a sleeve, or they already had a bariatric surgery and they regained, and now they're coming back for a revision. When I got to the point where I felt like my revision surgeries were higher than my primary surgeries, and revision surgeries are more risky, I was like, as a provider and as a surgeon, we're missing the boat. I felt like we were doing something wrong because the percentage was too high. I get stuff happens, right? Like some stuff happens, but it was too high of a percentage for people to just keep coming back for surgery after surgery. So that was like, I've got to do something different. And that's kind of when my 4 pillars took root. Like, I'm like, I've got to figure out what's going on and what's the problem, because they'll be like, oh yeah, I'll eat better, but then they don't. And so I'm like, I have to show a little bit more stronger commitment in if they truly have a why, or if they're like, I just want to look good, or whatever the case may be. So now I almost like pick my patients. Like, the first appointment or the initial consult will tell me if they're a good fit for the program. People who want sustainable, they love it. They love the fact that I'm doing it. Like, they love me, I love them. You know what I'm saying? The ones that just want a surgery, I give them referrals to other surgeons, because I just don't do it that way anymore.
Mm-hmm.
Yeah. I feel like I'm not helping them.
Yeah.
And they just don't know it yet. You know what I'm saying? But I've seen it enough, and so I try to explain, like, this is not, we've got to identify these roots, we've got to fix these things first, because there's always something that triggered all this, whether it's from childhood or whatever the case may be.
Yeah, absolutely.
Yeah.
Absolutely. So what is your number one piece of advice when someone comes to you for trying to figure out their why, essentially? Like, what do you tell them besides asking the question why, like for
Yeah. So I usually say, what is your motivation? Like, why, how do you want to, they're like, I don't know what my why is. And then we just start having a conversation. Like I had a patient who wanted to come lose weight. And I'm like, why? First she was like, oh, because I just want to look good. And I was like, well, what about, she has a son, a young son. And then I was like, okay, well, and then we started kind of talking more about her family. And then she was like, you know what? I feel like I can't move around with him as much as I want to. And I feel guilty because it's just me and him. She was a little bit older and he was younger. And she was like, I've got to live for him. So it's almost like just talking to them and helping them. Okay, what else is going on in your world? Which is why that initial consultation is so important, because people always have kind of their textbook answer, so to speak. You've got to get under that. And I don't think people will let you get under that though until they feel like they can trust you. So for me, I usually can get it on the first visit. Sometimes it may take the second visit, but there's always something underneath, right? They may give you some like out plastic answer, so to speak, but there's always something. And it's just talking to them about their environment. So when I talk to my patients, I find out everything. I want to know about their family, what do they like to do, kind of all these different things, because what are their goals in 3 years? Where do they see themselves? And that will often help them come up with, oh, this is why, because in 2 years, X, Y, and Z. You know what I'm saying? Or I like doing this and I can't do that anymore. And so just kind of talking to them about what they like to do, what their goals are, and their like family life usually helps bring out their why.
Yeah.
Yeah.
So a lot of inner self-talk about why you do the things you do and who you
Yeah.
are as a person and what
Yeah.
motivates you every day.
Yeah, correct. Exactly.
Perfect.
And again, that comes down to self-awareness. And like I said, some people have no clue. So I usually be like, okay, if money wasn't an option, time wasn't an option, what would you want to do? Because they always think about what they can't do because they have to work or they have kids, they have all these time constraints. So sometimes when you take the restraints away, what would you want to do? Where do you want to be? Who do you want to be? Who would you want to be? And a lot of times that'll help. And then it's like, well, why can't you? We in general think so much as what we can't do. And in general, you just need to think more in terms of what you can do. I mean, we always talk about what we can't. Oh, I can't work out. I don't have time. Oh, I can't, I don't have time to cook, or whatever the case may be. And so usually I'm like, okay, well, what can you do? We'll start there. Meeting them where they are, and then kind of going from there.
Yeah. And then when you ask them, what can you do? That opens up the positive dialogue of, oh, I can actually do this and this.
Yeah.
And, I have more to offer than what I'm offering myself.
Yes.
So that's perfect.
Exactly.
Yeah.
Yeah, exactly. And then they get excited. They're like, oh, again, it's almost like they didn't even think about it. And I'm like, see, now you can do X, Y, and Z. You're right. So, yeah.
Awesome. So when an individual discovers their root of the problem, what's next for them?
So once we discover their root, we start treating. We come up with a treatment plan. And again, it may not be meds. I mean, you're going to see a doctor in my office, but I may not give you meds. It may be, hey, you need to go do self-care, or, because believe it or not, that's important too. Like sometimes I just prescribe self-care, and I'm like, and it doesn't necessarily mean, go to a spa, but what do you like to do and feel peace? What do you like to do and feel joy? Let's start with that. I mean, sometimes it's just, especially for busy moms, like my women patients, it's almost like you need to take time out for yourself, that, because if you can take time out for yourself, believe it or not, you'll be a better mother, a better wife. And then you can actually start moving towards your weight loss goes a little bit better because you're not so stressed out. Which stress in itself can, as we all know, can cause all these different problems. So once they find the root, we just put together like a treatment plan, an implement plan. And I often give them like goals to meet, right? So in 2 weeks, this. And I ask them, okay, what can you do? So they're like, okay, well, I can meditate for 5 minutes. I'm like, hey, I'll take it. 5 minutes every day for 2 weeks, you know what I'm saying? Or whatever they can start doing, you'd be surprised. No one ever seems to have time. And then when you almost like prescribe a treatment, I'll be like, okay, you need to go for a walk 3 times a week, and they actually start feeling better. It's something so basic. And then they start to see that they actually can fit it in their schedule. And then that kind of motivates them to go to the next thing. So that's how we do it.
That's awesome. I love it.
Thank
I think
you.
what you're doing is amazing. I have one more question before I let you go.
Okay.
And it's about your book. And
Yes.
you wrote a book, and I just want you to share what it's about. And yeah.
Yeah, no, I wrote a book. I actually have it here. Transformation is a mindset, the journey to changing your input and changing your world. And it has a combination of what I talk about in the 4 pillars and in general, what we've been talking about. Like this stemmed from my time with bariatric surgery and private practice and finding out a lot of the biggest issues my patient had was what the story they were telling themselves, whether it was, I can't do it, all the I can'ts. And it's like, we need to change these words up, to I can, or I will, even. I will. Say you will. There's no reason why you cannot do it. And so it goes through a guide, almost like an education guide of how you get rid of these bags, so to speak, that you're carrying, that everybody's carrying. We all have them, that we've been carrying around for multiple years. That's where the real weight is. It's all this baggage that we're carrying, whether it's self-hate, low self-esteem, lack of self-control, all these like different things that we kind of carry around. And it takes you on a guide on how to get rid of those things. It talks about how you need to be aware of them because some people aren't even aware, and we've been talking about that. And then it talks about how to get rid of them. And you may have a relapse, right? There's a chapter in there about relapse. Everybody has it. That doesn't mean you're a failure. So a lot of times when people go back to a bad habit or old habits, it's like they throw in the towel as though, you know what I'm saying, I'm the worst person ever. You're not the worst person ever. This happens to the majority of people. It's how you respond to that. And so it kind of goes into, how do you respond when you relapse? You just get back up. You know what I'm saying? Have a mentor, have a support person that you can call or go to. So it kind of talks about all that, mostly in the context of weight loss and wellness, but it can be applied to any major problem people are having. I talk about addiction because food addiction is real. And it's a lot of the same thing that people go through with alcohol addiction or drug addictions, you know what I'm saying? And I also go depression when people are just in a bad place. So it can be related to that because a lot of my patients come in with weight loss, but they also have several other medical problems and then several other mental health or emotional things that we need to address too. So that's what the book does. And it's essentially saying, change your mindset first. Then now let's tackle everything else. Once you change your mindset, you can truly tackle anything. And that's what that's saying.
Absolutely. I agree.
Yeah.
Once you switch your mindset into the I can mindset, then you really can tackle anything that you want to do in your life. And it's an amazing thing. It really is. It's crazy.
Yeah. Yeah.
Perfect. Well, thank you so much. I know you have a special offer for our attendees. Would you like to
Yes.
talk about that offer real quick?
Yeah. So I am offering, it's called the Jumpstart Bundle. And essentially, it's going to be a combination of 2 books. So it's going to be our Transformation is a Mindset book and the Best Diet Is book, which talks, everybody's always asking me, what diet should I be on, doctor? You know what I'm saying? So it has all the diets in one book. And then at the end, I kind of summarize what I think is going to be is the best diet. So I'm combining those two books for a special offer of $25 plus shipping. And if they leave a review, then we will send them a free wellness supplement and they can choose that. So if you buy the book and then for the special promo price and then leave a review about the books, we will send you a free wellness supplement. So
Perfect. What a great deal.
thank
That
you.
is awesome.
Mhm.
Okay, guys, the link is in the chat. It's going to be in the Facebook group, and I'm also sending it out in the emails at the end of the day, along with your homework. This has been so great. Thank you so much, Dr. Hamilton. This is Dr. Franchell Richard Hamilton. She is a bariatric surgeon, and author, and the founder of the 4 Pillars Transformation Program. Thank you so much again, and thank you for shedding light in this wonderful community.
Yeah. No, thank you. Thank you so much for having me. I really appreciate it. I really appreciate getting the word out and motivating whoever will listen.
Absolutely. Thank you so much, and have a wonderful rest of your day. We'll talk soon.
Thank you.
Thank you.
Bye.
Bye.